Dick, when your crew is here, if you want to ask Justin to do the breakout rooms, feel free whenever you think your crew is here.
Okay, I see we've got 4 of us.
I'll be in the smoking section.
Bad for you.
Oh, wait, is that weed? I want to go to work. Hey, Gary, I was thinking of you. Let's pass that bill. And while you're out trying to sell a used car, you can have your mechanic come by doing this. You can call it green auto sales.
Yeah, we've got.
Why don't we just go to the breakout room and the rest will catch up to us?
Got only 1 remaining, I think.
Representatives, I think that in this format, we're always live streaming, just to let you know.
Right.
Oh.
Oopsie. Justin, are you there?
Yes, I am.
Just to give you a heads up, you may have already thought of this, but since Senator Daughtry is with us and Senator Miramont is not, you might have to reassign the break rooms.
Okay, thank you. Yeah, I have them set up. I have nobody assigned yet, but when I can select every person singly, so I'll make sure I get them in the right ones. Yeah, thank you.
All right, awesome. Yep, thanks.
I will just wait for the go ahead to have you all enter your room. I know we're waiting for Senator Gearin and Representative Gear.
Are you able to send Senator Guerin over after we go to the breakout room?
I believe so.
Yeah,
Okay.
here's Representative Gear.
Why don't we go there now then, if it's okay?
All right, just give me a couple of minutes and I'll get you all there. You have 4 right now, Representative Bradstreet, is that correct?
That is correct.
I will send you into your room.
Thank you.
Sorry, hold that. I'll have to get everybody selected first. My apologies. I'm having a little bit of an issue with this. I'll get this set up for you just as soon as I can.
No worries, Justin.
Representative Sylvester, are you under Jersey, Sylvester?
My son changed,
Okay.
used my computer, and I can't figure out how to get it back. So yes,
Okay.
that's me.
Okay.
I'll change my name.
Semester, I can give you, I figured out how to do this on mine. So afterwards I can call you and walk you through the steps. So
Yes, I need the tutorial.
perfect. I was done with showing up as moderation brewing everywhere.
And my link, oh, you're still there, Dick. All right.
For some reason, we were transported back to the main room.
Yeah, it's I don't have this. There's some timers and stuff set, so let's see. I'll have to change that after.
Well,
Hopefully.
beam me up, Scotty.
So if I can get you there.
That room had a very high quality control, Representative Drinkwater. It would have refused all of us.
As in, I didn't meet the standards.
That was my joke, yes. The politicians after all.
I got it.
Yeah.
Should be all set, so I'm not sure why it would kick you out. So I think I have all of our officials in their rooms, aside from the ones who are not with us yet. So hopefully this works out. I apologize if we have any more problems. I will certainly try to get it fixed, but it should be fine.
We're not seeing an invitation. Normally we get a little in. Oh, there it is. Perfect.
There you go.
For folks who are watching, we're just waiting for everyone to rejoin from their corner caucuses, and additionally waiting for some of the bill sponsors to join us for the work session. For those who are wondering, we are going to be going in numerical order as they are listed on the website. And just one other note, I'll mention this again when we get to it, but we have had a request from Senator Davis on his bill 1753 to table that until a later date. He's still working on it, so we will be tabling that once we get to it. So let's see, 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, just gonna wait for a couple more folks and we'll kick things off. Let's see. Just waiting for, I don't see Representative Prescott. Let's see, got Representative Morris. Where is Representative Bradstreet? Do we have him with us? Oh, there's Representative Prescott. Okay. I think we're ready. I'm seeing a critical mass of committee members. So committee members, if you're here, if you could turn on your video just so we can get things started. I'm going to kick things off. Welcome everyone back to the Joint Standing Committee on Labor and Housing. We're back this afternoon for work sessions, and thank everyone for their patience. I know for those who've been waiting for work sessions, it has been a long morning, and apologies for the delays. So we'll be taking things, as I said, in numerical order. So we're going to kick things off with LD 898, an act to provide incentives to unemployed workers to become part of the caregiver workforce. We do have the bill sponsor, Representative Jess Faith. She'll be here because she actually has some new language to present. So I will pass it over to her, and then also know that we have some folks she's asked to testify on the language, as well as the departments. Without further ado, Representative Faith.
Thank you, Senator Daughtry. And first, I know that this committee had a significant loss this morning. Our friend Donna Dorr passed away, and I just wanted to express my sympathy and my sadness. Donna was my friend, and she will be greatly missed. So in her honor, let's talk about how we can hopefully improve the direct care workforce, both for the workers and for the people who need direct care. So we had I think, a rather robust conversation about this bill and the amendment last week. So I really don't want to take up much of this committee's time. You've had a long morning already, and I know there are other bills that you need to get to this afternoon. So the amendment that I presented to you last week remains almost completely unchanged, except that based on some conversations with the Department of Labor and a concern that they expressed about the definition of database, which does seem like a rather significant lift. We, instead of in section, I think it's 8, part F, instead of requiring them to establish and maintain a database, we're simply saying that this advisory committee should collect data related to the essential support workforce. And then, because staffing is always an issue for committees, but also for the department, I think we landed in a place, or I landed in a place where we're trying not to put a big burden on the department to staff this committee, and simply would just like someone to be available for the meetings so that we have someone to take notes. And those are really the two changes from what I proposed at the last work session. I don't think they're particularly substantial from a perspective of functionality of the committee, but I think they make it a little bit more, a little bit easier for everyone to get the work done.
Thank you, Representative Fay. Do I have any questions from the committee? Seeing none. I do know, I'm obviously coming into this a little bit late in the game, that there are a few folks that had requested to speak on it, as well as the departmental folks. Wondering, I have a list. I have Jess Marr and Jess, I'm sorry if I'm massacring your name, Mallory Shaughnessy and Mike Smith. And then we have folks, I know Molly Bogart is with us from the Department of Health and Human Services, as well as Kim Moore from the Department of Labor. So let's start, let's kick things over to Jess. I know this is not necessarily a traditional public hearing, but if we can still try to keep comments to about 3 minutes, and I'll count on my co-chair to keep moving us along. But yeah, we'll go Jess, Mallory, and Mike.
Great, and thanks so much. I'm Jess Maurer, the Executive Director of the Maine Council on Aging. And just wanted to say before I start that a number of folks were lined up to also speak in support of this bill, and that they have provided testimony in writing online because they weren't able to stick around for this session this afternoon. So with apologies from all of them. Excuse me, I will now start my formal response. So Senator Daughtry, Representative Sylvester, and members of the Joint Standing Committee on Labor and Housing. As I said, I'm Jess Maurer, the Executive Director of Maine Council on Aging. Maine's essential support workforce is pretty complex, as you've already heard and we'll hear more about. Workers in the field provide support with activities of daily living for older people, people with disabilities, including intellectual disabilities, people with behavioral health challenges. They provide these services in the person's home, whether that's in an actual home in a community or in a facility. Sometimes the government pays for these services. Sometimes people pay out of pocket for these services. And really last year, for the first time, the legislature recognized that this labor force is in fact one labor force, not disjointed parts working for different populations, mostly because they're categorized that way because of different payer sources. It also recognized that this labor force is woefully inadequate to meet existing demand for support services, and it took action to implement some of the recommendations of the Commission to Study Long-Term Care Workforce Issues. Since the Commission's report was issued, many state agencies and state officials, many of whom are here in this meeting today, have been working remarkably diligently to address our essential support workforce crisis and to implement many of the recommendations of the Commission. They're doing this across agencies and with I don't know how many tens or maybe even more agency officials across multiple agencies. And realistically, that means that, you know, and on top of COVID, by the way, so they haven't been able to share a lot of information about progress sort of in a public way on a regular basis, which means we haven't always been up to speed with what's happening. And it also means that not a lot of projects have launched, and the ones that have launched haven't yet made much impact on the crisis. So the amendment to LD 898 is exactly what's needed for this moment in time to make progress in addressing this workforce crisis. It proposes to create an essential workforce advisory committee that would receive quarterly updates on progress on implementing workforce initiatives, collaborate on research needed to understand staffing levels and increasing demand, monitor the growth of the workforce, make recommendations about additional actions needed, and also specifically address the benefits cliff issue. One of the recommendations of the Commission's report was to create an oversight committee. Over this year, it has been increasingly clear that some sort of an advisory committee is needed so that that interested parties, and really very importantly, the public, can gain consistent and regular access to the same information about what's happening to solve this crisis and what progress is being made, and to offer ongoing
And Ms.
insight.
Maurer, Ms. Maurer,
Go ahead.
unfortunately,
Yep.
we're over your time by about 45 minutes or 45 seconds or so. So you could go ahead and wrap up. That'd be great.
Sure, absolutely. All right, so the two pieces then I'll just say is that want to underscore that there's much more research needed, specifically because a lot of workers are leaving the workforce to care for older relatives, and it's deepening our workforce shortage exponentially. And then additionally, we need to actually do something to help people who are on welfare, receiving public benefits, to work more hours as opposed to just helping them navigate through a career. So that's all I have to say. Thank you very much.
Thank you so much. Any questions from the committee? Not seeing any. Let me check my list again. Thank you so much for your time. Up next, we have Mallory Shaughnessy. Welcome.
Hi, can you hear me okay?
We can hear you.
Excellent. Good afternoon, Senator Daughtry and Representative Sylvester and members of the Committee on Labor and Housing. My name is Mallory Shaughnessy, and I am a resident of Westbrook and the Executive Director of the Alliance for Addiction and Mental Health Services. On behalf of the 35 members of the Alliance across the state of Maine, I am here to speak in support of the amendment to LD 898. We commend Representative Fay for continuing the dialogue with the stakeholders over this extensive time period, and on this important piece of legislation, and for the version that's before you today. When Representative Fay, as co-chair of the first convened the Commission to Study Long-Term Care Workers Workforce Issues, the behavioral health workforce was not included in that discussion. Too often we have looked at long-term care as not including behavioral health. It is more for folks that are aging, folks that are living with physical or developmental disabilities. And but when you look at people that are living with schizophrenia, schizoaffective disorder, severe anxiety, and other severe mental illnesses, the care and treatment is often long-term, sometimes for their entire life. And the need for support on a daily or weekly basis to remain in their home safely and meet their basic needs is present. And the need for long-term care supports in residential facilities for these folks is also necessary. It is all long-term care, and it is all done by these essential support workers. So we are very excited to start participating in these discussions over this last year to really look at our essential workforce and the crisis that we have within it, and realize that across all of these service sectors, as just alluded to, across all of these different service arrays, we are talking about a group of people who are doing very critical, very needed work, and unfortunately for very low pay and with severe lack of benefits, often having to rely on public benefits. And then they work too many hours and they lose those benefits. So it's a critical discussion to be having, and it needs to be informed by people within the field that are doing the work, and people that are providing the agencies that are doing this work, and the people that work for them. So we're very excited that this idea of an advisory, essential support workforce advisory committee has been put forward, which would have a wide variety of administrative, educational, legislative representatives, as long as people from the various service delivery areas to inform the department and the legislature on comprehensive, meaningful advice and counsel for what is really needed out in the field, what kinds of educational development is needed, the rules and regulations that oversee this type of work. So we are very proud to be here and have unanimous support from the Alliance, and hope that you provide it with a unanimous ought to pass vote. And with that, I'd be happy to answer any questions or get you any other information that you might need if you happen to have another work session.
Thank you so much. Do I have any questions from the committee? Seeing none, thank you for your time this afternoon and your patience.
Thanks.
Up next, I have Mike Smith. Mike, are you with us?
I don't believe Mike Smith is with us, Senator Daughtry.
Okay, thank you. With that, I think we're going to switch over to the departmental folks unless Representative Fay, if there's anyone else that we've missed. I'm not seeing any hands or okay, so let's move on to I do believe we have Molly Bogart from the Department of Health and Human Services. Welcome, Ms. Bogart.
Good afternoon. My name is Molly Bogart, and I'm Director of Government Relations for the Department of Health and Human Services. It's good to see you all. I don't often get to be in this committee. I have with me Deputy Commissioner Beth Ham and Joy Gould, who's our healthcare workforce manager in the commissioner's office here. And really, we're here to be available if you have questions. I don't have any prepared remarks, but we're happy to engage as you see fit.
Thank you so much. Representative Sylvester.
Thank you. Ms. Bogart, thanks for being here. I'm wondering, one of the pieces of this is the credential ladder, and I wondered if you could talk a little bit about that, and then the benefits calculator. Just bring everyone up to speed on that. Thank you.
Sure, absolutely. And I'll ask Ms. Gould to talk about the credential ladder, and then Deputy Commissioner Ham can chime in with a little bit of background information about the benefits calculator.
Great. Thank you, Senator Daughtry and Representative Sylvester and committee members. I'm Joy Gould, Manager of Healthcare Workforce at LBHS, and we are really working closely with so many of you around this table actually to create a career pathway. The idea behind that pathway is opportunity and recognizing not just the skill set of these workers, but that they can continue to grow in the field. So we're looking at a baseline credential that would allow direct care workers to have a little bit more flexibility than they do currently around serving a broader variety of participant, and then layering that with a variety of specialties, for example, dementia care, or on the behavioral health side, other more targeted training. In addition, we're building those certifications within degree programs. So for example, on the physical health side, if someone is working as a DSP or a PSS, how could that roll into a nursing degree? On the behavioral health side, how could that roll into a social work degree? I don't know how much detail you want me to go into. I could talk about this. I'm very passionate about it, but I'm happy to answer questions.
Thank you. Do you have any questions from the committee? I'm not sure. Representative Bradstreet, I have a shocked face and a raised hand, so I think you get to jump in before Representative Drink.
My cursor jumps all over the place sometimes.
No worries.
Thank you for being here. I've got a copy of the report, the efforts and progress in implementing the recommendations of the Commission to study long-term care workforce issues. And I'm just wondering, I haven't had a chance to look at the entire report yet, but does the report, is there something in the report, or does the existing framework, can it be utilized to answer some of these issues that this bill brings up? I'm just wondering if they have so many different parts and pieces moving here that we forget about maybe something that's already in place.
Sure, and I can take that question. The long-term care workforce task force that Representative Fay and Senator Herbig chaired in 2019 did a lot of really good work on setting forth recommendations for the how to support the workforce task force. And of course, that was prior to the new reality we're all living in with COVID-19. And so, we found that a lot of those recommendations are applicable to what's now a more acute challenge that we're dealing with in the behavioral health, mental health, long-term care workforce that we're all dealing with. I think that, this administration and certainly the Department of Health and Human Services, and I think I can speak for our colleagues at the Department of Labor, share the commitment toward implementing those recommendations along with other strategies to address the workforce challenges that we have here. And, I think the report that we shared hot off the presses this morning goes to demonstrate that commitment. And so there's, regardless of whether this bill passes, I think we will absolutely continue to carry on that work in partnership with the stakeholders around this table and with, the other departments in the state.
Thank you. Any other questions from the committee? I did see initially Representative Drinkwater and Representative Gear's hands shoot up. So I don't know if either of you had your questions answered or if you have anything else.
I'm good.
And she answered my question. Thank you.
Perfect. We're just being efficient with our questions. Any other questions or anything else that the department would like to add?
We're happy to have Deputy Commissioner Ham talk a little bit about the benefits calculator. I heard the concern about the cliff specifically, and that might be new to this committee. So if that would be helpful, I'm sure she can give you a quick primer.
Absolutely. And welcome, Deputy Commissioner.
Thank you, Senator Daughtry and Representative Sylvester for having me. My name is Beth Ham, and I'm one of 3 deputy commissioners here at the Department of Health and Human Services. And I just want to start off by saying that I think I have some good news to share with the committee about the work that's being done on benefits cliff. So just give you a quick preview of the work that we've been doing in the past 5 years, actually, in coordination with the 5 other New England states. So New England is actually emerging as a leader in developing policy solutions around the cliff effect. And in fact, Maine has enacted policies in previous legislative sessions to address the cliff effect. And rather than list them all out, I'm happy to provide more information to Molly and she can share it with the committee. But the one thing I would draw your attention to is a national conference of state legislators white paper that's been done on the work that the New England states are doing with regard to the cliff effect. And as part of that work, we, Maine, our local group, partnered with the Federal Reserve Bank of Atlanta to develop a Maine-specific calculator or dashboard, as we routinely call it, to help provide users like our workforce participants with matching them up with a coach and a case manager to walk them through the benefits cliff tool. And what that tool really does is it demonstrates, again, with assistance from a trained coach, how various careers can impact their household income and public benefits over time. But I think of interest to this committee may also be the fact that it is meant to be used by policymakers such as yourselves to see when certain policies are presented before you or considered. It can also demonstrate what that looks like from a public return. So it's very exciting. We're going to be launching it at the end of this month. It will run for 3 months. We have enlisted pilot sites. They include Family Futures Down East, our Aspire FedCap program, Kennebec Valley Community Action Program, Macaulay Residents, Maine Immigrant Refugee Services, MERS, will be participating, as well as one of the career one-stops. And we're also engaging with the community colleges to get them on board as a pilot site as well. So I'll stop there and let you ask any questions that you might have, but I just want to say that I will send Molly information about all of the work on benefits cliffs that has been done and continues to be done. And I would also just let you know that the 6 states met with Federal Administration for Children and Families, their leadership last week to talk with them about all of the work that we're doing. They're very interested at a federal level because many of the policies that impact the programs and benefits that folks are receiving are cross-sector in the federal government. And we really do need their help in working with the states in order to navigate these very complex program rules. So I'll stop there.
Thank you so much, Deputy Commissioner. Representative Drinkwater.
Thank you, Madam Chair and Deputy Commissioner Ham. Now, this bill that 898 that we're talking about, an act to provide incentives to unemployed workers to become part of the caregiver workforce. It sounds to me like this would be a duplication of your efforts that you are already doing and have been doing. Would you read that the right way as far as my opinion goes? A duplication of effort?
I would just reiterate what Molly Bogart said. There's a lot of work going on, and I think some of it is not as visible, or maybe we're not doing the most effective job at getting the word out about all that's going on. And so that's why I wanted to give you a little preview of everything that we're doing with regard to benefit cliffs. So I would just echo my colleagues' sentiments along those lines.
Thank you.
Do I have any further questions from the committee? Yes, Representative Bradstreet.
Thank you once again, Madam Chair. Yes, thank you for being here. The proposal has a sunset of January 1st, 2028. Do you think something like this could be done in a shorter period of time, so that the goals of the organization can be met sooner? Or is this something that needs to be ongoing for that period of time?
I can take that, Representative. I think I might actually defer to the sponsor on that. I don't think our workforce problems are going to be solved anytime soon, but we're certainly committed to making progress on those at every step. And so, you know, I'm not sure the sort of purpose behind that date specifically, but I imagine this work will continue past that. And I also don't think there would be any delay or hesitation because of that date being relatively far out.
And I don't know, Representative Fay, if you had anything to add on there, or if Representative Bradstreet, if you wanted some more information, or.
No, I don't need any more information. I guess I'd like to know some of the justification. Are these some programs we're going to put into place so that, you know, the parts are in place to handle things that come up, or are we going to keep identifying new things that come up that need to be addressed? And cannot the existing structure handle those things?
Not entirely sure who to pass that over to. So if anyone, I don't know if Representative Fay or Ms. Bogart, if you have something to add in there.
I think it's an interesting question, right? Because the policy is always changing based on the situation on the ground. And the reason why we chose an end date was, first of all, I think sometimes there are commissions that or committees that continue probably past the time of their usefulness. But the other piece of the puzzle is that just because there's an end date doesn't mean that the legislature at a future time couldn't decide that maybe that this needed to be an ongoing thing further into the future. I think the direct care workforce shortage is something that we're going to be working on for quite some time. Right now, the great work that DHHS, DOL, the Maine Community College System, and others are doing, and how we coordinate the communication between all of that work, the stakeholders, the legislature, so that this committee and others don't necessarily have to keep coming back every couple of months to check in and see what's happening. I think the whole vision was as sort of a conduit and a depository for that information and a place for those conversations to happen when the legislature wasn't in session, because we all know that a lot happens between June and December, or April and December. I'm not sure that answers your question, Representative Bradstreet, but that was the vision behind it.
Okay, thank you. Appreciate that.
Thank you, Representative Fay. I have Representative Gear.
Thank you, Madam Chair. And thank you, Representative Fay, for continuing to work with this bill. And I think the thing, and it kind of follows on from Representative Bradstreet's question, which is, I was just trying to get through the report a little bit and see what the progress has been. And I do think, because of the nature of this challenge, that it is so multidisciplinary and it does cross so many parts of government, it is really helpful to have this view. I think that's for, all the folks that are working on the challenge. It's really important to have that. And it's also important for the legislature to have that on an ongoing basis so that we can see when further action is necessary. And I agree with you, Representative Fay, that could be, next month, that could be 5 years from now, because this is not going away. Our population is not somehow going to start sprouting from the ground like mushrooms. We're gonna need people to do these jobs. So I think the thing for me, and I always put on my measurement hat, and anybody who knows me knows I'm a stickler, it's almost like having a dashboard view of that report that would say, how do we know when we're being successful? What are the key metrics that are going to make us say, yes, it's working. This is working. This thing we're trying is working. Because I think it's great to see the progress, and I really am encouraged by all the great work that's going on. But I think both for you all and then for the legislature as well, it would be great to see that kind of report, that whatever those measures would be, that would indicate, we're seeing more people flow through this channel, or we're seeing, this many people managing their benefits cliff, or, those key metrics would be really, really helpful to see. And they might exist. I'm just trying to find them.
Thank you, Representative Gear. I don't know if.
And I guess it's kind of a question for Representative Fay. If in the question there, is there a sense that those kind of metrics exist currently, or they still need to be created? Kind of where are we in that process?
I think that's a fantastic question. And I think that's part of the reason why we need this committee, because I think that's part of the charge of the committee, is to determine the answer to the question that you just asked. Because it's possible that the information is out there, but imagine that you have, 10 or 15 people constantly asking, one department or another for that type of information. And I imagine that this would streamline that process for them so that they wouldn't have to keep coming back and answering questions from individuals who all have the same goal.
That would be great. Thanks.
Representative Sylvester.
Thank you, Madam Chair. Since I'm the person who asked to hear how these programs were going, I just wanted to say I appreciate the department for coming forward. We're going to hear from labor in just a minute, but I think that one of the other key pieces for us to keep in mind is that this is not just a one-way street for us to get in, these caregivers to get information, but also for the departments to have the folks who are out in the field right there to provide, to be a resource in one spot where they can pose questions and gives updates and get feedback. So I think that that's a pretty critical piece of this. And so I think I'm looking forward to hearing what the Department of Labor has to say as well. Thank you.
Thank you, Representative Sylvester. And I think that's a perfect transition, unless anyone has any objections, to switch over to the Department of Labor. Thank you to everyone from the Department of Health and Human Services for coming today and sharing your wisdom. And with that, I think we're going to skip over to Kim Moore from the Maine Department of Labor. Welcome, Ms. Moore.
Thank you so much. Good afternoon, Senator Daughtry, Representative Sylvester, members of the Joint Standing Committee on Labor and Housing. I'm Kim Moore. I'm the Director of the Bureau of Employment Services at the Maine Department of Labor. I'm happy to follow up after my colleagues at DHHS to talk about the joint efforts that we've been contributing to this work, specifically to promote opportunities, connect job seekers to direct care careers, align or stack credentials to centralize access to healthcare related training and supports, to also support and grow the current direct care workforce, and help workers to make informed decisions on career paths that lead to better economic outcomes for their families. So earlier today, you should have received a table that goes into detail about each of the initiatives that we're developing and the partners and the advisors of the work. Those initiatives were informed by the efforts of the Commission to Study Long-Term Care Workforce Issues, as charged by the Joint Standing Commission or Committee on Health and Human Services, to study and, in their January 2020 report, make recommendations in several areas of focus. And as you know, tomorrow DHHS, in partnership with Department of Labor and Department of Education, will present to the Commission the first annual report, which you received a little bit earlier today as well. So I'd like to take a couple minutes to give you a quick overview of what's being done, who the work will impact, what that intended impact is, and how the work is being measured. And before I get started, I should mention that the majority of this important work is funded through the Governor's Main Jobs Recovery Plan and related federal grant funding. So each initiative has related multi-stage business cases that are reviewed by an executive steering committee, and it's composed of commissioners and DAF staff. In addition, a workforce cabinet, which is composed of Department of Education, Health and Human Services, Labor, Economic Community and Development, the Humane System, and Maine Community College leadership. It's also staffed by our own Department of Labor representatives and the GoPIF office. They convene monthly meetings to review progress and advise on workforce-specific initiatives to ensure there's alignment across the system. And through this process, each one of the initiatives has specific metrics to evaluate impact. And then separately from that, the Center for Workforce Research and Information, or CWRI, will conduct an evaluation of the impact of all Maine Jobs and Recovery Plan healthcare workforce initiatives. That's a mouthful. So let's talk about each one of those initiatives. So first, we have the campaign to promote direct care careers, which is the first of a three-phase media campaign that connects with and recruits all persons of all ages and communities into frontline healthcare careers. So this campaign has been informed by a diverse advisory group, including several related associations and providers, legislators, and the Maine Long-Term Care Ombudsman Program, who has also hosted discussion groups with direct care and support workers to learn more about their jobs, why they do them, and what would make them better. The campaign development has also included a survey that received responses from over 700 direct care workers and those who are considering the career. That campaign is anticipated to launch in late February and will include traditional and social media, a website, and worker recruitment events. The campaign messaging will be customized to really speak to our target communities that were named in the report, specifically men, people with disabilities, older adults, younger adults, new Mainers, and communities of color, in order to increase the number of individuals in direct care jobs among those target audiences, to also increase overall awareness of the career opportunities that exist, and to elevate that perception and appreciation of these really essential careers. The campaign impact will be measured using traditional marketing metrics, website visits, impressions, that kind of stuff, and then through employer satisfaction surveys at the very least. The next initiative kind of ties the rest of them all together. So that's healthcare training for me, which again ties together the related work of DOL, DHHS, Department of Education, Adult Education, Maine Community College System, and the Humane System. So healthcare training for me creates that centralized location to access training and training supports offered across the state. Most of these at no or low cost, thanks to federal and private funding. So this is intended to be a no wrong door approach that connects employers and job seekers to training across the system, utilizing a quick information gathering process. A shared team between our partners will triage these inquiries and make direct connections to training offerings, funding sources, and supportive services to meet those training needs. Information about career pathways and related labor market information will also be integrated into the site, allowing for self-exploration and connections for those who maybe don't need that one-on-one assistance, just want one place to find that information. So then healthcare training for me kind of serves at that front door for what is formally called the Training for Incumbent Healthcare Workers. We call it the Tuition Remission Program. So that one, launching in March, is intended to help healthcare workers who are currently working gain skills and advance with their employer through financial support and support for advanced healthcare credentials. So the Tuition Remission Program is designed to directly address the training needs of employers across provider types and sizes, locations, including physical, oral, and behavioral health. The initial focus of training support will be on technical training that leads to a recognized credential and a move up that career pathway. and as needed can expand into support for foundational skills education. For example, contextualized math and English, including English language learning. The initiative is designed to increase participation in and completion of upskilling credentials, increase the average wage among healthcare workers, and increase worker retention in the field. The next initiative that you'll see on that chart, I'm going a little bit out of order, apologies for that, but a healthcare training for me will also connect those who've struggled to connect with or even to re-enter a healthcare career pathway. And that's through 2 full-time healthcare career navigators. So these 2 folks will be embedded in the career centers, and they'll connect with individuals who complete the healthcare training for me intake process and indicate that they need one-on-one assistance to create those person-specific employment and training plans, help to figure out what training opportunities are for them, and assist with evaluation and translation of prior credentials should they have them, and make those essential connections to healthcare jobs and apprenticeship opportunities. So navigators are going to focus their work on incumbent workers in healthcare settings struggling to move up, those who are interested in entering the field, foreign trained healthcare workers looking to become credentialed or to move into a related healthcare occupation, and on employers who are interested in connecting with these workers. And of course, the impact of this initiative is focused on connection to training and jobs, which will be captured and measured using our main job case management system. The last one I'm going to talk about today is how healthcare training for me also helps to connect workers and employers to expanded healthcare pre-apprenticeship and apprenticeship programs for the sector at large. But again, an emphasis on increasing the representation within apprenticeship programs among communities that have been disproportionately affected by the pandemic. There's currently an active request for application process that's open to any interested employers, industry associations, labor unions, education and training providers, and community-based organizations who might be interested in expanding healthcare registered apprenticeship programs, increasing the wages among participating apprentices and retention with those employers, and increasing the overall number of apprentices in Maine with a twist, with a specific focus on increasing representation in apprenticeship programs among Black, Indigenous, people of color, women, justice-involved individuals, and people with disabilities. So this one is funded by both the Maine Jobs and Recovery Plan and federal apprenticeship grants. And so they will continue to report quarterly on program participation, apprenticeship completion, wage growth, retention, and those general demographics of apprentices that will help us to evaluate the effectiveness of these really cool, new, innovative approaches to pre-apprenticeship and apprenticeship. I'm going to stop here. That's a lot of information. But again, we're really hoping that the Healthcare Training for Me website will help to provide some of that connectivity to some of these really, really great emerging programs. And I'm happy to take questions.
Thank you, Ms. Moore. I have a question from Representative Warren.
Thank you very much, and thank you for your testimony. I'm really concerned about some of what you were speaking about in relationship to historically marginalized communities, because as I think we all here understand and know that part of our longstanding issues with the direct care workforce have to do with the massively low wages, the threat to kind of general safety and lack of the benefits and other sort of workplace protections. So I'm wondering if you can, I guess, speak about the relationship between these admittedly already historically marginalized communities, and it sounds like very specifically targeting and wanting to seek greater representation before maybe dealing with those other, what I would argue maybe root cause issues.
Great. Thank you, Representative Warren. I'm happy to try to address that. First, I would say that these are the populations that were identified through the work of the Long-Term Care Commission. And I believe we were charged with particularly the public service campaign as one of the last session's bills. So this is the successful funding of something that we were charged with, but unfortunately didn't land the funding to be supported moving forward. So specifically to address your question around marginalized communities that are being targeted, certainly by the marketing campaign, our goal Maine Department of Labor, is to make sure that we're meeting people where they're at, wherever they're at, and then not to drop them. So if the best first step for an individual is in a position that maybe has flexible hours, has a little bit more reliable of a schedule, some of the things that are some of the pros and cons of some of these positions, then that will be our job to make sure that we're getting them connected, not to leave them there, but we're helping them to grow among the career pathway, and that we're here to support them, whether it's through education and training or connection to opportunities as they are ready to grow.
Thank you so much.
I appreciate. Could I ask a follow-up question?
Absolutely, go right ahead.
Thank you. I was speaking to the legislation, I guess in part that you're talking about. I was the only member of this committee that voted against that piece of legislation, and for that very reason. So if I could be misremembering, but I believe that there was quite a bit of support from the department as well as other entities. And so I guess I'm just wondering at this point with this funding, how is that reconciled? And if all you're able to say at this time is that you're implementing the laws as written, and maybe those issues as they're related aren't, that you're not seeing the connection points, I guess maybe that speaks to the relevance of this legislation as it's been proposed, the amendment. Maybe that's to see the bigger picture or how these different components connect, but it sounds like that's just not, I guess, relevant to the how you've given this big presentation about all these different things. It's really just me, nothing more to say at this time, other than that it's the law.
I'm sorry, I don't know if everyone else was breaking up. I'm sorry, Representative Warren, was the question if whether the campaign is directly connected to the legislation? Might be my connection.
Yeah, no, it's probably me. So I'm just wondering, you gave us a very big picture of all these different actions that are being taken to address this workforce shortage. And so I guess I'm asking you, how do you reconcile the targeting in this campaign with all the other issues that it seems like you're saying the department is beginning to address and does acknowledge? That's what I'm asking about. So it is the law. It is a bill that was passed by this committee and by the legislature. You're giving us a very big picture. So I'm wondering how you saw that, because people could disagree with the law and we're legislators and able to change the law. So that's what I'm asking about.
Gotcha. I don't know that I'm prepared to answer that question, but I'm happy to get an answer for you.
So with that, I have Representative Sylvester and then Representative Bradstreet.
I guess I would ask if Representative Bradstreet has a question for Ms. Moore, because otherwise I was going to make a motion.
Just a quick one.
Absolutely.
I will cede and come back.
Thank you. You mentioned a couple of times about the funding sources. Are those funding sources going to continue throughout the length of this commission, or is that something that has to be renewed on an ongoing basis?
Thank you. So the current funding that we are speaking of, I believe, goes through 2024, 2025 or so. So as we are measuring the impact of each one of the initiatives, we would be looking at continued funding and sustainability. And those are all issues that we have to address in the business cases as well. No one wants to walk away from this work.
Okay, thank you.
With that, Representative Warren, you still have your hand up. Do you have another question? All right. Moving over to Representative Sylvester.
Thank you, Madam Chair. I want to thank the departments for coming. We appreciate all your information. And at this time, I would make a motion of ought to pass as amended.
We have a motion of ought to pass as amended on the floor. Do we have a second? Seconded by Representative Gear. Do I
those trucks or whatever transporting wine.
have
You would be looking at the inventory tracking system to make sure you feel it's robust enough that you wouldn't need paper each time. You would want them to specify where their home base is and where the other locations are. And maybe there could be some kind of specification of.
Is that
Justin,
Senator
can you find
Hickman we're
who has their
listening
mic
to?
on?
Craig. Okay. So with that, with a little excitement for all of us, since we're starting to tarry, we have a motion of ought to pass as amended made by Representative Sylvester, seconded by the ghost of Craig Hickman's audio, as well as Representative Gear. Do we have any conversation or any comments on the motion in front of us? Representative Warren, is your hand still up from before?
No, I have a different, I just wanted to comment on the motion that I do appreciate work that I saw piece on this, and I really appreciate Representative Fay speaking with me about the amendments, and yeah, so just appreciate it. I do feel that this is an enormous issue, and I want to see action as soon as possible, particularly because we do have that study and report back last year. So I wish that had been the direction that this concept draft had been finalized in, but I think more information and more transparency is always good. Connected between departments is always good, and I'm very happy to support this amendment and appreciate everyone's patience with me from.
Oh, Representative Warren, I do think your audio is jumping a little bit, but I think the crux of what you're saying is appreciation for working through this with the team. We're getting every couple of words are jumping out. So thank you. And with that, do I have any further comments on the motion before us? Seeing none. Oh, I think Senator, nope, not coming from Senator Hickman. With that, I think I'm going to call the vote. Newbie question: how do you all typically do your votes on labor and housing? Do you have the clerk call the roll, or do you have? Okay.
Mr. Purvis, if you would call the roll.
Yes.
Senator Hickman,
Yay.
Senator Gearin, when she gets on screen.
Nay.
Nay. Okay. Senator Gearin, nay. Senator Daughtry.
Yay.
Senator Daughtry, yay. Representative Sylvester.
Yay.
Representative Sylvester, yay. Representative Bradstreet.
No.
Representative Bradstreet, no. Representative Cuddy. Representative Cuddy looks to be absent. Representative Drinkwater.
Nay.
Representative Drinkwater, nay. Representative Gear.
Yes.
Representative Gear, yes. Representative Morris.
Nay.
Representative Morris, nay. Representative Pebworth.
Yes.
Representative Pebworth, yes. Representative Prescott.
No.
Representative Prescott, no. Representative Rader.
Yes.
Representative Rader, yes. And Representative Warren.
Yes.
Representative Warren, yes. So the call is 1, 2, 7 in favor, 5 not in favor, and 1 absent.
I was muted. With that, the motion of ought to pass as amended carries. For those who voted in opposition, is there a minority report?
Ought not to pass.
Ought not to pass. With that, thank you, Representative Fay. Thank you to the departments and all the individuals who come to testify today. And thank you for your patience with the late hour. With that, I will close the work session on LD 898. And moving right along, in the words of the Muppets, we're going to open up LD 1746, an act to expand the 1998 Special Retirement Plan to include employees who work for the Office of the Chief Medical Examiner, and go from there. I don't know if our OPLA analyst would like to jump in. Representative Sylvester.
Yeah, that's what I was going to ask. Mr. Langland, do we have a analysis of this?
Yeah, I can go over a little bit.
Thank you.
Sure. So you should be seeing my screen. I put together sort of a chart of all the retirement bills. I think the committee found that sort of useful last year, our last session, I should say. Obviously, won't have as many this session. So this bill allows employees in the Office of Chief Medical Examiner within the AG's office to participate in the 1998 Special Retirement Plan. And under that plan, as you know, a person can retire at a reduced benefit at 55 years of age with 10 years of creditable service, or before 55 years of age with 25 years of creditable service. You should have received an amendment from Senator Hickman. If you recall at the public hearing, the retirement system testified that as drafted, there would be a compliance issue with the Internal Revenue Service because they do not allow members to choose their plan. So the retirement system thought it would be better drafted to avoid that IRS compliance issue, to have everybody shifted into the 1998 special plan rather than having those employees make an election of their own. As drafted, the bill was prospective, meaning the benefits would be going forward. Senator Hickman, in his amendment, proposed making the bill retroactive. And as I've noted, those two issues were both flagged by the retirement system, and those have been addressed in the amendment that you received. Representative Bradstreet wanted to know how many people over time have been moved into the 1998 special plan and how much that has cost. I did have a discussion with the retirement system, and we are working on getting those figures for Representative Bradstreet, but unfortunately, we don't have them for today. And I would also note that Eric Hyatt, who testified in favor of the bill, he did follow up with testimony with job descriptions of what some have called the clerical positions. And I forwarded that to you in an email sent on January 26th. The committee also did receive a preliminary fiscal note on the 28th, but it was on the bill as drafted. And so if the committee were to proceed with Senator Hickman's amendment, it would go through the fiscal note process again, and the figures are likely to change. So with that, I'm happy to try to answer any questions. And Kathy Morin from the retirement system is also here.
Thank you so much, Mr. Langland. Am I saying your last name right?
Yep, you got it.
Okay, perfect. Still learning the ropes. With that, I don't know if the committee has any questions, or Senator Hickman, if you'd like to jump in, or Ms. Morin.
I just wanted to say that the amendments were drafted based upon the department's testimony. And so I think it fixes those issues. The fiscal note will probably change a bit when we run through my amendment, if in fact it is the committee's pleasure to pass it. And I just want to remind the committee that we did not take a vote last session on this, so I cannot say that everyone would have voted on it, but we did pass a bill unanimously where we were intending to include this particular provision in a committee bill that we did not actually report out because it got lost in all of the flurry of the end of session work. So despite anything, I think that it was our intention last year to include these positions in a very similar piece of legislation that has already been enacted into law. And so I would hope that the committee would do the same for this legislation. Thank you, Madam Chair.
Thank you, Senator Hickman. Did I see Representative Sylvester? Did you have your hand up?
I just wanted to make sure that if Ms. Morin had anything she wanted to add.
Thank you, Representative Sylvester. I would just mention that we did have the opportunity to review the amendment, and that the concerns that we had addressed in our testimony are addressed in the amendment.
Excellent. Thank you so much. Representative Sylvester.
Thank you, Ms. Moore. And with that, I would make a motion not to pass as amended.
We have a motion of ought to pass as amended made by Representative Sylvester on the floor. Do I have a second? Seconded by Representative Warren. Do I have any conversation or comments on the motion on the floor? Seeing none, I'm going to run this like an auction. Keep on going. Justin, if you could call the roll.
Yes. Senator Hickman,
Yay.
Senator Hickman, yay. Senator Guerin,
No.
Senator Guerin, no. Senator Daughtry,
Yay.
Senator Daughtry, yay. Representative Sylvester,
Yay.
Representative Sylvester, yay. Representative Bradstreet,
No.
Representative Bradstreet, no. Representative Cuddy, absent. Representative Drinkwater,
Nay.
Representative Drinkwater, nay. Representative Gear,
Yes.
Representative Gear, yes. Representative Morris,
No.
Representative Morris, no. Representative Pebworth,
Yes.
Representative Pebworth, yes. Representative Prescott,
No.
Representative Prescott, no. Representative Rader,
Yes.
Representative Rader, yes. Representative Warren,
I need to send.
Yes.
Representative Warren, yes. So we have ought to pass as amended, 7 in favor, 5 ought not to pass as amended, I believe, and 1 absent.
Thank you. And just to clarify for the minority report, is it ought not to pass?
Yes.
Okay. With that, we have motion of ought to pass as amended with the majority vote. And with that, I will close the work session on LD 1746. Up next, we have LD 1753, an act regarding the retirement of law enforcement officers under the participating local district retirement program. The bill's sponsor, Senator Davis, has asked if we could kindly table this. He's still working on it. So at this time, I would entertain a tabling motion from the committee. Representative Warren.
I would like to make a motion to table.
We have a motion. Do I have a second? Seconded by Representative Prescott. All those in favor, we're just going to do a show of hands. Especially with the 2 hands from Representative Drinkwater, it is unanimous of those present and voting in the committee. So I will now close the work session on LD 1746.
Senator Daughtry, my apologies. Could you share with me who seconded that motion?
It was Representative Prescott.
Thank you.
And then we are staying in the world of retirement, it looks like. Moving on to LD 1808, we have an act to address employee retention at the Maine State Police Crime Lab and the Computer Crimes Unit in the Department of Public Safety. And I will kick that over
5, 6, 7
for Opal analyst.
So you mean back room, not warehouse, right, Larry?
Well, like, yeah, so-
And you are unmuted again. Okay, now we're good.
Let me share my screen. Go. So this bill requires that service retirement benefits for employees of the Department of Public Safety, Maine State Police Crime Laboratory, and Computer Crimes Unit included in the 1998 special plan be computed on the same basis as our benefits for other members under the plan. And creditable service is included regardless of when that service was earned. The retirement system testified that the bill as drafted is a little bit non-traditional. It's unallocated language. It's not standardized. And the bill that the committee just voted on actually puts that in statute. So the committee might want to consider whether they want to make that technical change to actually codify that in statute or whether they want to leave it as unallocated language. And the bill also eliminates the need for employees to make an election. So the committee might want to consider amending the bill to reflect language that shows that. I'm happy to answer any questions, and Kathy is still with us.
Senator Guerin, followed by Representative Gear, and I'm not sure which dog is singing the song, but someone is. Or
Thank
maybe
you.
a committee member.
It's not my dog. My question for Mr. Langland is, who exactly is this adding to the plan. Didn't we pass a bill last year that had the crime lab people, the people who were examining the evidence and the computer crime people? So who did
Yes. Yeah. So what this does is it avoids the split plan problem that comes up. So what happens is members who are shifted into the 1998 special plan, they have their benefits computed under the special plan only for the time after they have joined the special plan. And so benefits before that are computed under their sort of normal retirement state plan. So what this does is it makes it so all of those benefits are calculated as if these employees had been under the 1998 special plan from the beginning.
Follow up, Madam Chair? Would this be the case like we had the firefighters last year and they paid in to bring themselves up to the special plan?
No, my understanding is that, and I should have said, and I'm sorry that I didn't, we did receive a preliminary fiscal impact. So this does not specify sort of any self-contributions other than what is already under the 1998 special plan. And I'm sure that Ms. Moran can answer that question probably a lot more articulate than I could. But this is not a situation in terms of them necessarily buying their way back in. I think you're referring to LD 711, possibly from last session. But this is a bit different in that this is just sort of, it's not a PLD situation or anything. It's making so their retirement computations are all under the same plan rather than split.
There would be a cost, but the state would pick it up under this bill version.
Yes, so the preliminary fiscal impact statement is for fiscal year 21-22. It would be $1.4 million essentially, plus a little bit of money from the highway fund. And then ongoing, it would be 23,146, and then it would increase a little bit annually from there. So there would be sort of an upfront UAL cost, but then there'd be an ongoing normal cost.
Thank you.
Up next, I had Representative Gear, followed by Representative Sylvester.
I'm not sure exactly who this question would be for, but the concern that jumped out at me on this bill is to hear that we have language that is not consistent with the other legislation that we passed in this vein. And so I just, given the discussion this morning about the trouble that can get us into, I would really ask that whether we should wait on this and get an amendment to address that concern.
So it's not that it's wrong as drafted, it's just not in the usual way that the retirement system prefers. So what happens with unallocated language is that when you go to the legislature's website and you try to find where that is, it doesn't show up in the statutes. That doesn't mean that it's not law and that it doesn't have the same force as law. It's just that it's not easily found by the public. So it's not that the way that it's drafted is wrong. It's more of a technical thing in that if it were to be drafted and codified in statute, then it would be easier to point people in the direction of what it actually says rather than pulling up enacted law. So it's not that it's incorrect, it's just sort of a technical change.
Okay, I guess I would just ask the chairs if there's an amendment, whatever we need to do that. I think that would be an important thing to do, so it is findable. Thank you.
Thank you, Representative Gear, and duly noted on the need for an amendment on that portion. Representative Sylvester.
Thank you, Madam Chair. So just because it's late, I just want to remind those folks, particularly those who were here in the 129th, Senator Guerin, Representative Morris, Representative Bradstreet, that this was a bill that we passed unanimously out of the 129th. When we heard it, both of these groups were together, crime and computer labs. You'll remember the computer lab folks had some of the most graphic, terrible testimony. And we voted unanimously to move this through. It didn't get funded in the first session and then died because of COVID. In this session, people thought that Senator Diamond had put in the exact same bill as in the 129th. And so this is a fix on that mistake, which, you know, people from the computer labs testified on this bill because they thought they were in. And Senator Diamond didn't realize that it had been drafted incorrectly, and neither did the chair. So that's kind of where we are on this. It's been voted out twice unanimously, and for this, or once for this group and the other group, once for the other group. And so it's really just a matter of do we want to make sure that they get put in with it as we intended in the 129th, and as I think we thought we were doing again in the 130th.
Thank you, Representative Sylvester. I have Representative Drinkwater.
Thank you, Madam Chair. I don't know who this question should be directed to, but in the bill, it says qualified member. Does qualified member include clerical staff and perhaps the janitor also?
On this, I'm wondering if Ms. Morin could help us at all on that, or if not, I would love to hear from, I see that we do have Jeff McCabe from the MSEA. Man, is it getting late? Perhaps after we hear from Ms. Morin, he might be able to add to that as well. Ms. Morin?
Yes, thank you. I honestly will have to look back at the list of people, and I can do that if Jeff has any information to weigh in. I can pull up the list. My recollection is that it does include, it includes everybody in that office, but I want to confirm that. And again, I would ask if you can give me just a second to do that and maybe defer it to Jeff.
Yeah, Mr. McCabe, would you be able to join us and potentially answer that? Oh, we have a Sam. Hello.
So yes, I thank you for allowing me to be here. Jeff McCabe, I serve as the Legislative and Political Director for MSCA, and I'm joined here by my intern, Sam Bigney McCabe, who childcare for Sam today ended at 4 o'clock. So here we are. Yeah, so this, I will agree with everything that's been said. I appreciate the conversations and the questions. And I will start by saying, I'm happy to work with the bill sponsor and main PERS to make sure that we get an amendment before the committee for work session in coming days or week, just to make sure that we get the correct language and those needed statutory changes. This bill really focuses on the folks who are doing the analysis and in those 2 work sites. So I do hear the question from Representative Drinkwater. This shouldn't include folks that are doing like custodial work and those sorts of things. These are really from the folks that you heard from. And I'm not necessarily familiar with the fiscal note that's before you, but it's really the folks that are doing the analyst work and that type of thing. And I can provide, as part of that amendment, sort of a list of jobs and what those folks do and job titles, if that's what the committee wants. And I think Ms. Morin is back with probably her hand up and can say how she identified who they were for the purpose of the bill.
Yes, thank you, Mr. McCabe. And Ms. Morin?
Yes, thank you. So Jeff is absolutely correct. The list of positions that we have that we costed out and included in this bill include the people who are doing the forensic work, for example, the chemists, the forensic analysts, the DNA people. It does not include positions that by title at least would appear to be a clerical in nature position.
Thank you. Representative Drinkwater, do you have a follow-up?
No, I'm all set. Thank you very much.
Thank you so much, Representative. Senator Garin.
Thank you, Madam Chair. And my question is for Ms. Morin. Ms. Morin, am I not correct when I was thinking that we have offered these benefits to these people, but this bill is making it retroactive?
That's correct. That's what this bill does. The crime lab employees and the computer crime unit employees were added to the plan last session on a prospective basis. What this bill does is to give them that same coverage on a retroactive basis so that all their time in those positions counts toward this plan.
With no payment by them?
with no payment for so what results is it's an unfunded actuarial liability that's created. So that's the payment, the 1.5 million about is the unfunded actuarial liability that the state would pay. The employees on an ongoing basis, the employee contribution rate and the employee contribution rate on an ongoing basis is slightly higher than the normal costs for the regular plan. And so the employees would contribute on a go-forward basis toward that plan.
Okay, thank you.
You're welcome.
Do I have any other questions from the committee? What I'm hearing, I'll say, once again, being a new member of this committee and having spent the weekend trying to catch up, it does seem like we are potentially in need of amendment on this or a little bit more language before it's ready to prime time. And the bill sponsor isn't with us either. So I'm thinking, my gut instinct in moments like this is to probably table this, but I do see we have a couple other committee members with comments. So I'm going to go Representative Sylvester. Oh, Mike, do you still have a question? Okay. Representative Morris.
Yes, thank you, Madam Chair. I would make a motion to table the bill.
Okay, we have a motion to table on the floor. Do we have a second? Seconded by Representative Drinkwater. Tabling motion is non-debatable. So all those in favor through a show of hands. It is unanimous of committee members present and voting. So with that, I will close the work session on LD 1808. Moving along, slowly but surely, we have LD 1823, an act to amend the enforcement provisions of the law governing earned paid leave from Representative Rebecca Millette. And I will kick it over to our analyst.
So current law says that the Bureau of Labor Standards and the Department of Labor has the exclusive authority to enforce the new earned paid leave law. The proposed amendment that was presented at the public hearing by Representative Millette clarifies that parties to a collective bargaining agreement can agree to address those EPL violations through their contractual dispute resolution process. I would note that the sponsor worked with the Department of Labor and the department testified that it supports the amendment, and they also testified that in the first year of enforcement of the EPL, they did not receive one formal complaint regarding any violation of the law. And the annual report for EPL was submitted over the weekend, and you should have received that in your inboxes yesterday. I'm happy to answer any questions or, yeah.
Thank you, Representative Sylvester. You're on mute, Representative Sylvester. We're all getting punchy, folks. We're near.
Thank you. I would make a motion not to pass as amended.
We have a motion of ought to pass as amended on the floor. Do I have a second? Seconded by Representative Rader. Do I have any discussion on the motion? Representative Drinkwater, followed by Senator Guerin.
Thank you, Madam Chair. I see Mr. Bailey is with us. I would like to bring him forward to ask him a question, if I may, please.
Absolutely. Mr. Bailey, you should be able to unmute yourself.
Yes, I'm here. Thank you, Representative Drinkwater.
Mr. Bailey, during the testimony, I asked you about if you felt that this would bring binding arbitrations to the schools, which you answered in the affirmative. Could you expand some on why you think that this would do that?
That would happen only if the situations were to go through the final arbitration process as part of the dispute resolution issue. It wouldn't for anything else other than the earned paid leave aspect of things.
All right, thank you, sir.
Do you have a follow-up, Representative Drinkwater, or all set? Okay, Senator Guerin.
What LD are we looking at?
We are looking at LD 1823.
Thank you.
Do I have any other questions from the committee, or Senator Guerin, do you need a moment? All right, Representative Sylvester. Or, oh.
Thank you. Yep, I just wanted to make a quick comment.
Yep.
Which is that, in discussion during the testimony of the bill, binding arbitration is already part of every school contract. All the grievances that go through the contract can go to binding arbitration. So that's not anything new that's added. The leave, as we all know, the leave that the state provides is only in force if the leave that is given by the employer is less generous than that offered by the state plan or the state statute. Almost every union plan has more generous leave than this, and so the contract is what would be followed because that's the leave that's more generous. And so really what this is a clarification for the public if they have a question, so that it's there in statute to say that they can follow their grievance procedure. But as it stands right now, I believe that can already happen. But it's one of those things where we put that into statute because it makes things clearer for the public. So thank you very much.
Thank you so much, Representative Sylvester. Do I have any other comments, words of wisdom, thoughts, reflections? Seeing that, I think I'm going to call the vote since we do have a motion on the floor. And Mr. Purvis, if you call the roll.
Senator Hickman?
Yay.
Senator Hickman, yay. Senator Giron?
No.
Senator Giron, no. Senator Daughtry?
Yes.
Senator Daughtry, yes. Representative Sylvester?
Yes.
Representative Sylvester, yes. Representative Bradstreet?
No.
Representative Bradstreet, no. Representative Cuddy is absent. Representative Drinkwater?
Nay.
Representative Drinkwater, nay. Representative Gear?
Yes.
Representative Gear, yes. Representative Morris?
No.
Representative Morris, no. Representative Pebworth?
Yes.
Representative Pebworth, yes. Representative Prescott?
No.
Representative Prescott, no. Representative Rader?
Yes.
Representative Rader, yes. Representative Warren?
Yes.
Representative Warren, yes. So we have ought to pass as amended. 7 in favor, 5 not in favor, 1 absent.
Thank you, Mr. Purvis. With that, the ought to pass is amended. Is there a minority report?
Ought not to pass.
Ought not to pass. With that, pardon me, we've been sitting a long time and I had to stand, so I had to move the desk here. But with that, I'm going to close the work session on LD 1823. And moving on to folks, it is with great pleasure that I let us know that we are now on to our last bill of the day, LT 1840, an act to amend the laws governing retirement benefit reductions for correction supervisors currently included in the 1998 special plan. Try saying that 5 times fast. With that, I will kick it over to our analyst.
So this bill requires that service retirement benefits for employees of the DOC who are supervisors of correctional officers who are included in the 1998 special plan as of the effective date of the bill and who are employed prior to January 1st of the year 2000 be computed on the same basis as benefits for other members under the plan, and creditable service would be included regardless of when that service was earned. Representative Drinkwater had asked about the number of positions that might be affected for the work session. I did want to point out that the language is a little bit vague in terms of supervisors of correctional officers. So it's not clear if that includes correctional captains or unit managers or juvenile program managers. So it's not easily known what qualifies as a supervisor. And I just wanted to flag that for the committee's consideration going forward on the bill. So I think typically what happens is the retirement system will sort of obtain titles and sort of they'll have to have some sort of indication of whether those are correctional supervisors or not. And I think that if the committee could provide a little bit more clarity, then that might assist with getting an accurate representation for fiscal information. And I'm happy to try to answer any questions.
Thank you. Do I have any questions from the committee? Representative Sylvester.
I have a question for Ms. Moran, but basically the question, this is a separate bargaining unit, the supervisors at the correctional facility. So I'm assuming that we have a grouping like that, since they would be their own.
Thank you. So the retirement system doesn't group by bargaining unit, so we don't record that information in our database in any way. So that's not particularly helpful to us to know that. I can give you kind of an update of what we've done so far on this bill, if that would be helpful.
That'd be fantastic.
So we've talked both with Jeff at MSCA and with the fiscal office, who I think has been working with the department, and we've compiled unfortunately different variations of lists, which goes to the question of clarification from you as to who you consider to be a supervisor. In any event, I think the list is less than 20 or 25 people. It's a matter of honing in on what positions are intended to be covered by this particular bill.
Thanks for your help, you too. I still gotta do my daily committee report and all that stuff, right?
Justin, you are unmuted, so I'm going to mute you real quick. On that question, I was wondering if Jeff McCabe might have an answer for that as well from the MSCA. Why can I not say acronyms? That's how late it is. Mr. McCabe?
There might be some background noise for me too, and I can't mute him. He doesn't quite understand it, 7 months old, but I just wanted to echo what Ms. Moran said. I appreciate, we have been exchanging lists. It shouldn't be as complicated as it is, but it is kind of complicated. And to Representative Sylvester's point, we did even try to pull some seniority lists, and those have just not necessarily been the most up-to-date lists. I think that, you know, those types of tasks associated with trying to get them done during the pandemic has been a little bit of a challenge. So we are honing in on a list, and I think with a little bit more time, you know, we could have a very accurate list compared to what we have now, which is more of a range. And I would say it looks like it's probably 20 to 25 people. And I was happy to hear that Ms. Moran agreed that it was in that range. So I don't think we're that far off. I just don't have direct access to what the department has. So I think if the committee directs us, we can narrow that list down.
Representative Sylvester?
Thank you. I had a question for Mr. Langley. Mr. Langley, if we move this today and the list was presented to us in language review, would that meet requirements for our processes, or do we have to have an exact list when we vote today?
You don't have to have an exact list. You actually never have to have the language before you take a vote. If I'm clear on what it is that you're asking and you're comfortable voting, the committee can certainly proceed. That's sort of one of the tenets of doing language review, is that, you know, at that point, if something doesn't look right, or if the committee has a further consideration, then they could always reconsider. So if the committee wants to take sort of a vote today, and go forward with that, I think that would be the committee's prerogative, but I don't think it would be inappropriate.
Thank you, Madam Chair. If it's appropriate, I'd like to make a motion then.
Sure thing. Floor is yours.
Then I would make a motion ought to pass as amended to include supervisors with the list that we'll see in language review, as well as the fiscal note.
We have a motion. We have a seconded by Senator Hickman. Then I have Representative Drinkwater, followed by Senator Guerin.
Thank you, Madam Chair. I appreciate the representative asking for the fiscal note. I'm assuming because we don't have any firm numbers, we don't even have a range of what the fiscal cost would be. I guess I would direct that to Ms. Moran.
Thank you. We have not yet been able to do any costing on this bill because we don't know who to include in that costing. I don't know if what Mr. Langland has for information gets us to that list. Typically, the department would want to be part of that discussion The list that we received, as I said, from the department doesn't include all the positions from that the list that we received from MSCA did include. And so I think some guidance from you would be helpful from our end as to which list upon which we should rely to do that costing, or whether your expectation is that the department, that being DOC, and will work with the fiscal office, with Steve, with MSCA to compile a list that we would just then get and that we could do use to do our costing.
Thank you.
So this is something we'd be seeing the fiscal note that'd be coming back for us for a language review. So we as a committee will have a chance to look over it at that point. Senator Garin?
One concern I have with this bill is we allowed the special plans for the correction officers as incentive for them to go into that line of work. It's so difficult and really involves a lot of physical altercations at times. So I think by expanding it to supervisors, we're lessening the advantage of those people who really are in the trenches with the prisoners. And I think that is going to lead to them needing some additional incentive to stay in their positions. So for that reason, I would be opposing this bill.
Thank you, Senator Karen. Ms. Moran?
I would offer some clarification on the bill if it would be appropriate.
Absolutely.
So the people that we're talking about in this bill are already in the 1998 special plan, and they have been in the 1998 special plan, possibly back to 2000. What this bill is doing is, like the other bills that you've talked about today, is providing retroactive coverage in that plan for this small group of people. Currently, their time is under that split calculation that we talked about. So if what the bill says is, if today you're a supervisor with DOC and back in 2000 you were a DOC employee in certain types of positions, then that pre-2000 service time that you worked will count toward this. So you may have people who were guards, for example, back then, or any number of positions back then who are now in a supervisory position who have that split situation. So this is picking up the retroactive aspect of their service credit for people who are already in the special plan. I don't know if that helps provide some clarity.
That
does, thank you.
Any follow-up, Senator Garin?
No.
Thank you so much, Ms. Moran. Do I have any other questions, comments from the committee? Mr. Langland?
Yeah, I just want to sort of clarify what the committee has for an expectation. Maybe I didn't follow sort of what the committee was thinking. So I understand the committee wants to take a vote on it pending a list of titles. Is that what the committee intends to do? So at language review, or I'm trying to figure out, so obviously the fiscal note would vary depending on the titles that this committee feels appropriate to consider under supervisors. So I'm trying to figure out sort of procedurally how to sort of go about it without the sort of the committee having to have the fiscal office and the retirement system sort of cost out everything. I mean, I think maybe I'm overthinking it, but it seems like there could be a million different possibilities depending on what the committee sort of decides makes the final cut for titles. But I don't know if Ms. Moran sort of has what she needs to do, or if she's also sort of thinking along the same lines. But perhaps it's been a long day and I'm just overcomplicating and overthinking things. But
No worries, we're all there. It has been a long day. Ms. Moran, if you do want to respond, and then I have Representative Sylvester.
Sure. Because this is such a small group, what we've done in the past with some of these bills is that we'll just do the all-encompassing costing. And what we'll do is we'll get that cost on a per person basis, because the cost for each person is dependent upon their own service and age and all those things that factor into actuarial calculations. And so what we can do is we can have our actuary do the costs for everybody who's kind of on the two lists, which again is probably 25 people or so. And then we can bring that and the list of of positions back to you for your consideration. And then as you work through the list of positions and decide whether everybody's in or not in, then we would then kind of fine tune what those costs look like. Does that make sense for people? So I don't know, Steve, that addresses your concern.
It does. I think perhaps procedurally, maybe it makes sense. A tabling motion might be more appropriate then, pending sort of the information that you have to provide, but I'll leave that up to the committee, of course.
Thank you, Mr. Langland. Langland, I was thinking pretty much along the same lines, but I will defer over to Representative Sylvester, followed by Representative Warren.
I believe it's a list of folks that I think we have a pretty good idea, of who they are within a person or two. I would prefer to keep things moving and go with the largest list. And I think that we have a sense of who these people have been in the past in terms of having direct contact, with folks. And so I put it to Ms. Moore and Mr. McCabe that they're going to come up with an appropriate list. And if they want to give us a list of folks they weaned out for some reason, but I would at this point not want to withdraw my motion, but to continue to move forward.
Representative Warren, followed by Senator Hickman.
I just wanted to say I agree with what Representative Sylvester is saying. I would be comfortable still moving forward.
Thank you. Senator Hickman.
Hold on.
Okay, Representative Bradstreet, followed by returning.
No, I just wanted to turn off my other mic, Madam Chair, just so you couldn't hear. Can you just hear me now? Can you hear background? Okay, great. So all I wanted to say is that we're waiting on a fiscal note based upon these positions. I would like to move forward with the vote. If we have to reconsider the vote because the positions are such that no one wants to vote for the bill anymore, we can do that. But we have a deadline to get bills voted, and we tabled a lot of bills today because they weren't ready for a vote. And I believe that we should move forward with the vote. Of course, if someone makes a tabling motion after I speak, so be it, but I won't vote for it. Thank you.
Thank you, Senator. Representative Bradstreet.
Thank you, Madam Chair. Well, I was thinking of making a tabling motion, but I don't think I will. Anyway, probably Ms. Moran could answer this one better than anybody else. With the passage of this bill, will this, by any chance, make somebody instantly eligible for retirement where under the regular plan they would not be?
Again, these are people who have been in the 1998 special plan for probably a very long time. And so it is conceivable that the time itself won't make them, they already have that service credit for that prior time. So it's not changing how much service they have toward eligibility. What is changing is how their benefit is calculated. So it could be that people may choose to retire sooner because they can do so with less of a reduction, for example, for early retirement, but it doesn't change how much credit they have, how long they've worked, how old they are, those other key essential factors in terms of their calculation. It could make people eligible to retire or able to retire under the 1998 special plan in a more favorable way than maybe they can today because they have that split benefit calculation going on.
Okay, I'm also wondering what the UAL will be on it. So I'll be voting against the motion. Thank you.
Any other comments, thoughts, questions, aspirations? So not seeing any, just as a reminder to everyone, this is something we will be able to revisit at language review, and we'll honor if anyone wants to shift something or amend something. That's part of the process. With that, I'm not seeing any hands come shooting up with a ton of a passion. So I think I'm going to call the vote and ask Mr. Purvis to jump in.
Just a clarifying question. Is a motion ought to pass as amended right now?
Correct.
Okay. Yes. Thank you. So I'll start with the roll count. Senator Hickman?
Yay.
Senator Hickman, yay. Senator Guerin?
No.
Senator Guerin, no. Senator Daughtry?
Yes.
Senator Daughtry, yes. Representative Sylvester?
Yay.
Representative Sylvester, yay. Representative Bradstreet?
No.
Representative Bradstreet, no. Representative Cuddy is absent. Representative Drinkwater?
Yay.
Representative Drinkwater?
No, I'm sorry.
Okay.
Nay.
Nay, okay. Representative Drinkwater, nay. Representative Gear?
Yes.
Representative Gear, yes. Representative Morris?
No.
Representative Morris, no. Representative Pepworth?
Yes.
Representative Pepworth, yes. Representative Prescott?
Yes.
Representative Prescott, yes. Representative Rader?
Yes.
Representative Rader, yes. And Representative Warren?
Yes.
Representative Warren, yes. So the count is 8 in favor, 4 not in favor, 1 absent.
Thank you. With that, the ought to pass as amended. Have it, and what would the minority report be?
Ought not to pass.
Ought not to pass. And with that, very happy to close the work session on the last work session of the day, LD 1840. Thank you all. That concludes our work. I think you were all just trying to haze me with quite the first day, but thank you all for your patience as I learned the ropes. And with that, I'll see you all on Wednesday. Have a lovely evening, everyone. Take care and get some political free time. Take care.
Thank
Representative
you.
Drinkwater, I have you down as a yes.